We've all been hoping that this year ahead is going to be better than that which we were faced with last year. But we're starting this one off with an unwelcome precedent already in Madison County. For the first time in this pandemic, Madison County has been placed in red status, effective this morning at midnight. Madison County Health Department Administrator Stephanie Grimes, how did this happen? I thought we were doing better.
Yes, me too. As a matter of fact, I look at the cases every single day. Last week, we did have less cases per day, actually. However, the data the state is using to determine our red status is actually a week behind. So it wasn't this past week, like when I see the cases in real time, it was the week prior. We did have a lot of tests that week. And then I look at last week, and even though the numbers were lower, we have to look at the positivity rate. Again, this didn't put us into red, but I'm just looking at the overall picture. We had less cases, but what does that do to our positivity rate? So meaning if you have 100 people who come in to get tested, and some of them are sick, some of them are just want to see what's happening, just I don't know if I'm sick. So you look at how many of them are actually sick. So of those 60 cases that we had, was that out of 100 tests or was that out of 200 tests? So we have to look at that positivity rate, not just the number of cases. I guess that's what I'm trying to say. So I'm thinking about what put us in red coming off of Thanksgiving. Everybody's out and about and doing what they usually do during the holiday season. Looking at those weeks prior to, leading up to making us red, or that week that made us red, which Dr. Box said that many counties would jump up to red status as a result of that. So it's my hope that we look at all of those factors and holiday seasons, the way people behave, just people getting tired of it, looking at how we calculate what, and that contributed to a red status that we can now say, okay, moving forward, we've really got to buckle down. We've really got to get ourselves to a point where we're being more mindful. But then on top of that, now we have New Year's. So I didn't anticipate cases going down for probably until like third week of January. So that's really disheartening that we're already at red and we still have yet one more holiday to get through.
Am I mistaken, or do we have to stay in red status for a given amount of time before it can be reassessed and reclassified?
If we are red 1 week, like we are, orange next week, we still have to abide by the red advisory level. Then on week 3, if we're orange again, we can then decrease to the orange advisory level.
What does that mean for us as a county now that we're red?
So food establishments, bars, restaurants, nightclubs, gyms, fitness facilities, dance studios, those social type places will go to a 50% capacity. And they have to maintain all social distancing and sanitation requirements, masking. It's frustrating, and it is more strict than the governor's executive order. However, we need to do something because clearly what we were doing as we're going along isn't working. So I think more than anything, it's just a look, this is serious and we need to take this seriously. I mean, our hospitals are getting full, and I know I'm in constant communication with the hospitals, and they're tired. Their workers are tired, and we're all tired. And so please, if for no other reason, I did hear Dr. Adams, the Surgeon General, say, people who tested positive 2 weeks ago are this week's hospitalizations. This week's hospitalizations are the deaths that we will be counting in 2 weeks. So we're more than anything just trying to send a message. Look, you need to take this seriously. We need to stay home. I mean, when we say stay home, when we say don't gather, that's exactly what the message is. Don't gather.
What have your observations been as you're out and around as far as our behavior in Madison County?
I think most people are still mindful. I do see masks. I see most people masked. I have been to places where I see people who have no mask anywhere in the vicinity of their face. I see more people now with masks below their chin or just kind of like right below their mouth or right at their mouth. So I would just like to remind people, please continue to mask. Please make sure the mask covers your nose and your mouth. I know it's uncomfortable. I know it's a hindrance. I know it doesn't feel natural. It doesn't look natural. We just need to hang on just a few more months until we can get vaccine rolling. So that's my observation. As people are getting tired and they're masking and perhaps hand sanitizing is slipping, but we just need to stay the course a little longer.
Where do we stand right now as far as the vaccine rollout in Madison County?
The hospital in this county who is vaccinating healthcare workers have had it for a few weeks. They're a few weeks into vaccinating. They're doing really well. They're operating 12-hour shifts 7 days a week. They're getting healthcare workers in. I think it was just open to dentists and other healthcare provider types, school nurses. This week, long-term care facilities started being vaccinated, residents and staff. And health department is set to get vaccine delivered January 11th. That's kind of a big deal. We thought it was going to be next week, but we weren't going to start vaccinating until January 11th. Now will be delivered January 11th. We'll start January 12th. Still don't know exactly how many doses we're going to get. That really plays a big piece in how, like when we start offering dates, times, opportunities, and to whom. We haven't really been told who is eligible in Madison County. And what I mean by that is I know that the ACIP group, the federal group, gave their recommendations to the states, a couple weeks ago or a weekend or so ago. So what has to happen now is we have a committee in the state of Indiana who takes the federal data and says, okay, how does this match up with Indiana data? Are these the groups that we're seeing in Indiana that we really need to focus on? So that age of 75 and older, perhaps they may change that in Indiana to be younger, like maybe 65 and older or 70 and older. And then what are those health conditions that we particularly see in Indiana that may make someone eligible for vaccine sooner than later?
How do we look as far as long-term care? Are we slowing the rates down any, death rates and virus rates?
They're still testing. Long-term care facilities are still testing twice a week. We still get some positives from that. Long-term care facilities check in with the health department on a regular basis. We still have cases in some facilities around the county. We had quite a few deaths this week, unfortunately. But like I said, the deaths that we have now are as a result of infections that occurred 3 weeks ago. So it's hard to lump that all together. While we have had more deaths this week, I don't know that we've had as many tests positive the past week, if that makes sense. So these are folks who have been infected and they battled with it for a week or so.
Given your experience and insight, how much caution are you placing right now on the variant creeping in?
I'm not first of all, that's what viruses do. That's their job, is to invade and figure out how to survive regardless of what we're doing to try to stop them. That's just the life of a virus. So I fully anticipate that. However, I'll say this, we still have the power to prevent infection regardless. If we sanitize, keep our distance, wear our mask. The other thing I'll say about that is Dr. Fauci, I saw this morning, said that the vaccine that we're giving does still protect against that variant strain. So that's hopeful. I'm hopeful about that.
Have there been, and do you anticipate any corrective or punitive actions from the standpoint of enforcement?
Good question. I don't know. We look back, I say we, our health department staff, we look back on the past 10 months, 11 months, whatever, and we see what we could have done differently. We see, the shutdowns of our businesses and how that unfolded in the economy. And I think in terms of enforcement, that's a tough question. That's a tough question because we don't really have an enforcement mechanism in place other than if we were to pull a food permit. And we absolutely don't want to do that if we don't have to. So I think looking forward, that may be something to look into, just to be able to implement something like that, not just in the course of a pandemic, but just really looking at our policies and what we do and when and how. Because, like I said, we shut down businesses. We have this mask mandate, and yet there's really no way to enforce it. There's no teeth, so to speak. So I would probably look going forward, how do we fix that? What needs to happen to fix that in case we find ourselves in a similar situation? But, I also know, based upon comments that we receive, even just as a result of our going red status and implementing these restrictions, if we don't do something, we have people who are very upset with us for not doing something. If we do it doesn't matter what we do. We can impose all these restrictions, we can close, we can try to enforce, and people are fussy. And if we do nothing, people are fussy. So I think that's what we need to probably focus on in the future is how do we temper both? I mean, not that necessarily we have to try to make everyone happy. That's not, it's about public health and protecting our public health. It's just, how do we do that in such a way to be mindful of our economy and still keep people safe? Well, we learned a lot from H1N1, but it wasn't obviously to this degree. So we try to take the lessons learned from H1N1 and expand upon them, or apply it to how it's coming out now, but it's apples and oranges, really. But I'm thankful to have had that experience because, like, I look at vaccine and I know our first shipment of vaccine is not going to cover all of Madison County. And I know that we're going to have eligibility requirements. And while that happened with H1N1, I don't think it was probably as sought or as this will be. So it's that times 10. So we'll take those lessons and we'll apply that here. It's still tough.
Do people have to seek out the vaccine, or will they be notified that they're eligible for it, and if you want it, come and get it? Or how does one know when?
That's a good question. Okay, so now they're using state licensure boards to contact people like registered nurses, doctors, all those people who have certifications, as long as their email is up to date and they're regularly checking their email. They're relying upon, so for instance, and it's a link. It's a link that you click on and it takes you to a registration page and kind of walks you through whether or not you're eligible, and then you're able to make an appointment. They sent the link to me to pass along to frontline health department people, as well as any other potential nurse that maybe didn't get the link, or other healthcare personnel that I may know of maybe hadn't received a link for whatever reason. So we have that mechanism in place, and it seems to be going okay. But if you're talking about the general population and you're looking at perhaps an older population that may not be so comfortable using the internet, how do they log on? How do they access the link? How do we get that to them? So it might just come back to old-fashioned communication: radio, TV, newspaper. We'll certainly put it on our webpage and our Facebook page, but how many people can access that if that's a barrier? So I've already had people email just blank, like just a blind email. My name is so-and-so. I am however many years old. Please let me know when the vaccine is available to me. So even that is okay, I'm happy to let you know that, but I want to make sure it's all of the vaccine is available to everyone who needs it in a fair manner. So I can email this individual back, but then will I be considered, well, she picked and chose who was able, like, I just am really concerned about that. But what I think that is so important, because I've heard of other jurisdictions or other areas where maybe other people are getting vaccinated who don't fit the current phase. So a couple things about that. The state has said, we as a county may move from phase to phase more quickly or more slowly than other counties, just based upon our populations, based upon our ability to get people vaccinated more quickly or less quickly. So we may move through other phases more quickly, say, than maybe neighboring counties. And so we need to be prepared for that, number one. The other thing is, we've heard of like I said, other jurisdictions who have had vaccinations of people who didn't fit the current phase. But I'm going to tell you something. Bottom line is, we need shots in arms. That is the ultimate goal, is to get shots in arms. And with this particular Moderna, which is the vaccine we'll be getting, once that vial that holds 10 doses is punctured, it's good for 6 hours. So if for whatever reason we don't have appointments booked for that day, or it's getting to be close, or maybe people didn't show up at some point in the morning, I absolutely do not want to have to report back to the state or this community that we threw away doses. So if it takes getting shots in arms that maybe who didn't fit that criteria, somebody calls and it's just available, I do not want to waste vaccine. And I don't really think that anybody in this county wants us to waste vaccine, because it sure would be a shame if we're throwing doses away at the end of every day because someone didn't show. So I guess I feel like There will be a registration process. There will be a link where people will click on to make an appointment, but we have to have good old fashioned call in, make an appointment for that individual available too. So that's how we'll do it.
What would you like to see for us in 2021 as far as behaviors and cautions?
I would really love for us to continue to be diligent about hand washing, about keeping our distance, staying home if you're sick. If you feel ill for any reason, please stay home. I think we've got to learn from this for 2021. I mean, we need to learn that we can't take our health for granted. We can't take other folks' health for granted, and we really need to be mindful about. Look, this happened upon us as quickly as it did, and 9-10 months later, nearly a year later, we're still dealing with it. So we need to recognize our health is so very important. So please continue to wash your hands. That prevents so many diseases from being transmitted. It's simple. So just do that. Just wash your hands.
The Buzz of Madison County will update you as we receive updates from Stephanie and the Madison County Health Department on important information regarding vaccine availability. Stephanie Grimes, thank you for your tenacious efforts in keeping our county safe and informed. Please remember, when you can, support the small businesses in your community. Your community's future depends on it. Thank you for listening. That's the latest Buzz.